Finding Hope, the Road to Recovery.
Hello, welcome to Finding Hope, the Road to Recovery. I am your host, Chris Espinoza, Senior Supervisor of the Reseda Clinic at Tarzana Treatment Centers. Today we're going to be discussing a few of the services that we offer at Reseda. We have our guest speaker, Nicholas Herrmann, Physician Assistant, who's been with the medical department for over 6 years. Nicholas specializes on HIV, hepatitis C, STDs, and primary care. Over at Tarzana Treatment Centers, we offer different modalities and different treatments that we can help our different patients that come to us from substance abuse disorders. But Nicholas will be discussing a lot of his specialties. Welcome, Nicholas.
Thank you. Glad to be here. Appreciate it.
Nicholas, can you tell us a little bit about what HIV and AIDS is?
Yeah, so HIV stands for Human Immunodeficiency Virus, and it's a virus that can affect the human immune system. And it's a long-standing virus, and it's one that we aim to control because it can be transmitted through sex or through IV drug use.
Okay, so what type of patients actually tend to get this, or what type of population gets HIV?
Yeah, good question. So it's usually men who have sex with men is one of our largest populations that can get it, but really anyone can get it. It can be through IV drug users, it can be heterosexual, cisgender, transgender, pretty much anyone that can, anyone alive can contract HIV. But it's going to be mainly through sex or through IV drug use.
That's right. At Tarzana Treatment Centers, we offer a really good clinic on LGBTQ health as well. But you state that transgender male to female patients also have a higher risk of getting HIV?
That's correct, yeah. So we see certain populations that tend to have HIV at higher rates than the rest of the population. And a lot of that population does include people of color, and it includes minority sexual orientations as well. And so these are people that we want to focus on as well so that we can know about treatment and prevention of HIV. And that's a lot what we do at the Reseda Clinic, is treatment and prevention and education about HIV.
Is there a particular increase in the population that uses IV drug use for HIV?
That's correct, yeah. Any IV drug use, the virus can be transmitted through the needle or other injectable drug use. And so that population is very high risk for contracting HIV and hepatitis, among other infections.
So on top of being a sexually transmitted disease and obviously obtaining it from IV drug use, is there any other ways that people can get contaminated with the HIV virus?
Yeah. So anytime the skin can be poked or prodded, so sometimes there's medical professionals as well, or medical healthcare people that can be infected through a needle. It can also just, like I said, through sexually transmitted other IV drug use, anytime that the virus can enter the body. And so speaking sexually, that's usually going to be through anal penetrative or anal receptive sex, but it can also be transmitted through vaginal sex too.
I see. Is there a way that we can prevent HIV?
Absolutely. Yeah, there's definitely a way we can prevent HIV, and we really want to focus on this. There's ways you can do as far as protecting yourself, like wearing a condom when you're having sex, knowing your status, knowing your partner's status. But there's also medications out there now called HIV prevention, or is PrEP, preventative prophylaxis. And so those are medications that we prescribe a lot at our Reseda Clinic for prevention of HIV in people that are especially higher risk.
I see. So for these medications, for this PrEP medications, is there an array of different medications? Is there side effects that you can get from these medications? How do we go about getting medications like this to try to prevent it?
Yeah, so with Tarzana Treatment Centers, there's a whole intake team. So once you come to the clinic, we have a team that can kind of gain your risk factor and see if PrEP is appropriate for you. There's 3 different medications really that we're using now. The main one is going to be tenofovir. There's TDF or TAF, different formulations. And one is commonly known as Truvada, the other one Descovy. And these are once-a-day medications taken just usually in the morning or at night, just one time a day for prevention of HIV. And they work very, very well when they're taken as prescribed. 99+% effective when taken as prescribed. There's also an injectable medication that's out there called Apretude or cabotegravir, and that is an injection every 2 months for prevention of HIV, also extremely highly effective.
Oh wow, every 2 months now. So instead of taking a pill every day, you can just get injected once?
That's correct. Yeah, it's a nice to have as an option. So some people like to continue with that daily medication taken orally. Other people prefer the injection. And that's a discussion that can be had with the healthcare provider to determine if that's an appropriate solution or appropriate method for prevention of HIV.
Are there side effects for these medications, any of the medications, whether it's the injectable or the by mouth medication?
Yeah, so with any medication, there are going to be side effects. With the oral medication, the most common side effects are usually going to be some stomach upset, maybe GI nausea, GI gastrointestinal side effects. Sometimes headache when you first start the medication, but usually the body adjusts pretty well. These are pretty minor side effects, all things considered. And we do monitor a couple of things like kidney function every 3 months, and we also monitor STD testing, so we test for chlamydia and gonorrhea, HIV, of course, syphilis, among other things, usually about every 3 months.
How do you monitor this?
So we monitor it just through lab tests, and then there's also some swab testing that we do of various sites wherever the person has encountered or has had sexual activity. And so those are the areas that we do test, and the blood test monitors the kidney function as well.
You stated the medication is so good that it actually will prevent HIV, right? If there's an encounter with
That's
HIV.
correct. Yeah, these medicines are amazing. We live in fortunately in a time and age where we can prevent HIV very effectively. And so the side effects, again, are pretty mild. So it's fairly, the benefits vastly outweigh the risk here for most people for prevention of HIV. Because once HIV has been contracted, there's ways to control it, but we can't ever cure it completely. And that's where HIV prevention comes into play. So if you can prevent HIV, that's by far the best way to go so that we can keep everyone safe. We want people to be able to live their life, enjoy their recovery, but also not put themselves at risk for contracting HIV.
What type of patients would you recommend to go on with this PrEP medication?
So most of our patients are men who have sex with men, or people who identify as men that are having sex with multiple partners, or if they don't know the status of their partner, maybe it's a newer relationship and that trust hasn't been 100% established, or if there is trust and you don't know, it's just nice to be safe for yourself because you know what you're doing to protect yourself. Also for IV drug users, we want to get that population if they are previously using or actively using, still possibly putting themselves at risk for contracting HIV. Those are the people that really would benefit from HIV prevention or HIV PrEP.
I see. Tarzana Treatment Center specializing in different type of diseases. This is one of the things that we do the most at the Reseda Clinic. Are there complications that can happen, let's say if you use the injectable?
Yeah, so for the injectable, the side effects mainly going to be injection site reaction if that happens. And that's just, as with anything, you're putting a needle into somebody's skin. And so there's always a slight risk for an infection. We really don't see that too often. People maybe notice some discomfort for about a day, maybe 2 days after the injection at most, and it's pretty mild. So otherwise, the side effect profile is pretty well tolerated for that one.
I see. Do you ever see a lot of patients that don't stick to this regimen? What could be a complication for example, if they're supposed to be taking the pill every single day and then they stop taking the pill? What could happen there? Yeah,
that's a great question. So people that are supposed to be on the pill and don't take it, anytime they're off of that, if they are engaging in those behaviors, so unprotected sex or IV drug use that could allow them to contract HIV, though that's when they can contract that disease. So we want to make sure that those are the people we're reaching out to and getting them on PrEP, daily PrEP. Really, if you're going multiple days without it, if you're on a daily medication, if you're missing 3, 4, 5 days of medication and you engage in those behaviors, you're putting your body at risk. And so there are definitely a risk of contracting HIV when you have that.
I would say it would be pretty high, right, if they're going.
Exactly. And there's some great resources out there. The CDC has a wonderful website where you can actually plug in what activity you're doing, and you can see what your risk stratification is for each individual sexual activity. And so in the clinic, I'll go over that with patients. And we'll talk about the types of behaviors that they're participating in and what the risk is for that individual person. The highest risk is going to be with anal receptive sex unprotected, so without a condom, and that's the highest risk.
I see. Would PrEP work on regular heterosexual partners? So let's say if the husband has HIV and the wife doesn't have HIV.
Absolutely. This has been a very well studied subject as well. So it can be for anyone, heterosexual as well. If there's serodiscordant in this case, so the one partner has HIV, one partner does not, it works very, very well. Now, the person that has HIV, we want them to be in treatment, and we want them to be undetectable on their viral load, meaning that they don't have any copies of the virus circulating. But even if they're not, if the other partner is taking PrEP, we're minimizing that risk of transmitting HIV, even if they are sexually active.
I see. But as you stated earlier today, though, there are the unfortunate events that people do become positive. What type of services does Tarzana Treatment Centers have in the unfortunate event if somebody does become positive?
Yeah, so somebody that is on HIV PrEP, we want to make sure that they try to stay negative, but sometimes things happen where a person may experience homelessness, or if there's substance use, they're not taking their medication, or they forget or run out of medication. If they are engaging in other activities to become HIV positive, then we do have a lot of resources. We have case management services, we have services to assist with housing, we have mental health services. We have a lot of services that we really activate if a person does become HIV positive, because that is, it's a big diagnosis and it needs a lot of help.
I see.
Yeah.
And then you did also mention earlier, in the unfortunate case of a healthcare worker getting an accidental needle stick, there was some sort of medication, post-exposure medication that could help them. Could you explain that a little bit?
Yeah. So there's some medications we use for post-exposure prophylaxis. We call this PEP instead of PrEP. So PrEP is for prevention. PEP is post-exposure. And that's within 48 to 72 hours of anyone that is not on PrEP. If they had exposure to HIV or suspected exposure to HIV, they can come in and we can help them out with medications that they take for about a month, and different testing that we do as well to keep them negative. So there's ways we can do to prevent the virus from establishing itself within your body.
I see. Mm-hmm. And then in the unfortunate event that the patient came in after the 5-day or the 3-day period for PEP, then at that point, they would have to go on just a regular HIV regimen, right?
That's correct. So if somebody is positive, they test positive on either the rapid test or a blood test. There's various ways to test for HIV. So if they do come back as positive, we usually do some confirmatory lab testing, and we also try to start them on medication as soon as possible. We call this rapid start in medicine.
Rapid start. So that means the same day they get diagnosed is the same day they will start with the medication.
That's correct. Yeah. In the past, it was a little bit different. Sometimes they would wait, but pretty much now, most people, as soon as you get the diagnosis, we want to make sure you get medication for HIV and that you can help control that, because that's good for you, preventing the virus from replicating itself within your body and cutting down the effects of the HIV. But it's also good for any partners you have. So if you can get yourself controlled, you're not as likely to transmit the virus to other people.
In the unfortunate event that people stop taking the regular HIV medication, could you explain some of the complications that can occur?
Yeah. So someone that's either not on medication for HIV or was on medication and has now been off of it, what that virus does is it starts to replicate itself more and more and more. And when the virus is up to a certain level, it does kind of take a toll on your immune system. So it affects things, it targets things called T cells, which is play a huge part in your immune system. And over time, it kills those T cells. And so this can sometimes take months to years, but we see their immune system fail, basically. And so we see a lot of other infections start to pop up and come up. Infections that in the past they would have been able to take care of on their own, but now their body has been so weakened by the virus that these infections can become potentially deadly for them.
Oh, wow. I see. What do you think? Well, it would depend on the individual how long their lifespan would be, right? Depending if they get this infections, right?
Exactly, yeah. So someone that is HIV positive but is on medication and they stay in control, they can actually live a pretty normal lifespan. This is a great development that's happened. These medications we have now, most of them are one tablet once a day. And so we can control that infection pretty well for most people. But people that have had HIV or AIDS for a very long time, those are the people that we have to be a little more careful because they can be a lot more susceptible to different illnesses. And just for clarification, HIV is the initial infection, that's a virus. AIDS is called acquired immunodeficiency syndrome, and that is when HIV has advanced to a certain level, that the immune system is no longer able to keep up like it used to be. So people with HIV can develop into AIDS, but you really don't have. You can have HIV by itself and not have AIDS, if that makes sense.
I see. Right, absolutely. And then once you have an AIDS diagnosis, that's your diagnosis for the rest of your life, right?
Correct. Yeah, we can sometimes see the immune system recover to a certain level, but once you have dropped below a certain level on our labs, so these T cells, if they're below 200, we really have that diagnosis of AIDS, and that's a lifelong diagnosis.
I see. Are there injectables also to manage HIV as well?
Yeah, there's a new medication as well for treatment of HIV, and that's kind of similar to the Apretude for PrEP with another medication on as well. It's called Cabenuva or cabotegravir/ripivirine, and it's a medication that's given as well every 2 months, for treatment of HIV.
That's good. Are there a lot of patients that decide to go on this injectables?
Yeah, so we're seeing some more, and it depends on the provider and patient discussion on what they want to do for treatment of HIV. If they want to take a pill or if they prefer the injectable. A couple of that depends on the type of virus too and how advanced it is, and a couple other factors in there. But yeah, some patients really love the injection as well.
So it's tailored medicine per patient, right? So it's not just one regimen for all patients. We figure out what the patient needs and then we go with the best.
That's exactly right. Yeah. So it's always an individual discussion between the patient and their provider or their doctor. So it's you have to have the discussion, see what's best for this individual patient, and decide what is the most advantageous at that time.
I see. Can women be pregnant and have HIV as well?
Absolutely. Yeah. Women can be pregnant and have HIV. We don't have them breastfeed here in the U.S. after they give birth, but most of the time, women that are HIV positive can just take their medication through, and that's to be discussed with their provider as well. But they want to get that virus controlled so that we reduce the risk of transmission to the child.
I see. So on a marriage where a couple want to have a kid, and let's say the husband is positive but the wife is negative, that means that there is the chance where both the child and the mother will be negative too, right?
Yeah. So the best case in that scenario, you want to have the father be HIV positive but controlled. So you want to make sure that they are not able to transmit that virus.
I see.
So that would involve some planning on the primary care side.
I see. Mm-hmm. Okay. One of the other services that we offer at Tarzana Treatment Centers, Reseda, is our STD services. Nicholas has actually been working with this project for the last 3 years. Can you tell us a little bit about this program that we have?
Yeah. So we want to test people when they come in. So if anyone that has any possible exposure, or if they just want to get testing to make sure that they're okay before maybe getting into a new relationship, they're welcome to come in and get STD testing. So for a lot of the big STDs, so HIV included, syphilis, gonorrhea, chlamydia, and sometimes others as well.
And everything's managed in the clinic, right? So if somebody comes back positive, we will take care of it there.
Correct, yeah. So we encourage people to be in touch with the lab so they know about their lab results, but we will call people or let them know about their results. Some tests, like the HIV rapid test, you'll get the result that same day before you leave. Other tests, kind of like syphilis, might take a couple of days for that to get back because that's a blood test that is sent out to a lab.
I see. Mm-hmm. So one of the big things that were on the news last year was monkeypox. Did we experience this at Tarzana Treatment Centers?
Yeah. So we did have quite a few cases last year of mpox, and so that is something that is also out there, and we typically see with the population of men who have sex with men. And so there's a vaccine that's out there for prevention of that. So anyone that is at risk, so multiple sexual partners, or living in a household with somebody who has mpox, those are people that we can get vaccinated for mpox.
Does Tarzana Treatment Centers offer this vaccine?
Yes, we do. Yeah, we offer this vaccine to anyone that wants it and is eligible.
Oh, that's perfect. Who are people that could be eligible for this vaccine?
So for our population, mostly it's going to be among men who have sex with men that we see the infection. So any exposure to someone who has mpox, if they have skin-to-skin contact or sexual contact with that person, it can be transmitted.
So healthcare providers can also be...
That's correct. Yeah, healthcare staff and providers can also contract mpox if precautions are not taken.
Oh, perfect. I see. Is there anything else you would like to share about the programs that we have? I know we have a very robust hepatitis C clinic as well.
That's correct. Yeah. So for hepatitis C is an infection that can be transmitted through IV drug use, and that's who mostly we see our new infections. So people that can be brand new infected or have had this infection for many years and maybe never got it treated due to a variety of barriers that they may have experienced in the past. And so we have a clinic, and we can treat hepatitis C, so we can actually cure hepatitis C completely. And that's a big difference between that and HIV. HIV we can control, we can't really cure it, whereas hepatitis C we can actually cure that infection. But it does require coming into the clinic, and there's some labs that we have to do for a workup, and we also perform some imaging. And but people that go through that, yeah, we can get them treated, and they can be completely cured for hepatitis C.
Oh, wow. And often we have patients that have hepatitis C and HIV at the same time, right?
Right. So we call that co-infection. So some people will have HIV and hepatitis C. And so for those people, we want them to first and foremost get their HIV controlled, and then we get them also in treatment for hepatitis C. But we want to make sure that they get a stable recovery, a stable housing environment. We get their HIV controlled, and then we can focus on the hepatitis C after that.
Oh, wow. So a lot of factors come into play when it comes to person's health.
Exactly. Everyone's a little bit different, and so we try to tailor things to that individual person's needs and what they need.
Thank you so much, Nicholas, for this amazing explanation of the services that we offer at Tarzana Treatment Centers. We'll be right back with our next colleagues, Cesar and Joseph. They're going to be discussing a little bit of their personal experiences with HIV and the services we have at Tarzana.
Respect my choices.
Respect my body.
Respect my faith.
Respect
my vision.
my vision.
Respect my wisdom.
Respect my culture.
My culture.
Respect my future.
Respect my future.
Respect my words.
Respect my boundaries.
Respect my boundaries.
No.
No means no.
Means no.
Means no.
No means no.
Respect. Respect me.
Finding Hope, the Road to Recovery. Today, as we see the COVID-19 pandemic start to ease and the world open back up, the opioid epidemic remains out of control. Sadly, drug overdoses now exceed vehicular accidents as the #1 cause of unintended death in the United States. More than ever, now is the time when we must renew our efforts to find solutions for those afflicted. The answer lies in a vast array of treatment options that are backed by evidence-based practices contained within an integrated healthcare model. In this series, Clinicians and experts from Tarzana Treatment Centers, a Southern California nonprofit celebrating its 50th anniversary this year, will illuminate the road to recovery through interviews and presentations. Our simple message is this: that hope exists for you or someone you care about. Please join us to find out more.
Hello, welcome back to part 2 of the HIV/AIDS episode of Finding Hope, The Road to Recovery. I'm your host, Joseph Rivera. I'm a Program Operations Supervisor at Tarzana Treatment Centers in Reseda. I work for 2 programs, one called WHIP, which stands for Whole Health Integration Program, and that is funded by SAMHSA, the Substance Abuse and Mental Health Services Administration. The goal of that program is to connect people to services like mental health and substance use treatment, as well as helping them work on their goals to improve the quality of their health. I also work on a program called the State OA, Office of AIDS Program, for PrEP. And the goal of that program is to end this epidemic by 2030 by getting people connected to testing and PrEP services, which you may have heard about earlier in the first half of this episode. It's my privilege today to be here with my friend, my colleague, my former office mate, Cesar Corona. Welcome, Cesar.
Thank you, Joseph. It's a pleasure to be here. My name is Cesar Corona, and I am currently the program manager at Tarzana Treatment Centers for the Transitional Housing Program and the Incarceration Services Program, all under the Division of HIV and STD programs for the LA County.
Awesome. Cesar, a lot of people think of Tarzana Treatment Centers, and because I do a lot of outreach, and when I'm out there, they just almost always connect us with substance abuse or substance use disorder or treatment for recovery. And Reseda is just part of that big family of services, but a lot of people don't know what we do at Reseda. Can you tell us a little bit more about services at Reseda?
Sure. There's a lot of services that we provide at Tarzana Treatment Centers in Reseda, from medical care coordination to mental health. We have an HIV specialty clinic downstairs. We provide so many services, and if you're interested in more, you should definitely look us up. Our Reseda location is great.
It really is. Both of us have worked there for quite some time now, right? I'm going on almost 13 years. And
11 years. 11.
Yes. So it's been great. I would like to talk a little bit more about your time at Tarzana. I know that when you first arrived with us, you were a receptionist.
So I've been at Tarzana Treatment Centers for 11 years now. I've held various positions. I started off as a receptionist, then moved on to case manager, patient navigator, and then I was put in the position of a program supervisor for the intensive outpatient program. And I am now where I am currently here as the transitional housing program manager.
Awesome. So prior to that is what I want to talk about.
Okay.
In addition to just all the great work that you're doing at Tarzana, we know that it's one of the things that we see a lot where we are is that the people we work with not only provide services and treatment to people, but have their own personal stories. So I would love for you to share a little bit more about your journey in recovery. And I thought it was appropriate that we start from the very beginning. Can you tell us about this guy?
Yes, I can definitely tell you about this guy. This is young Cesar. Young Cesar is full of hope, joy, and imagination. He used a lot of humor, and he loved to have a lot of fun because it was his escape from his reality. I grew up in a family of addiction, and a lot of my family members were deep in their substance use, from my father being addicted to heroin, amongst other substances. Multiple uncles, which were about 4 or 5 of them, were using crack cocaine, methamphetamines, anything that they can get a hold of. And that was my reality on a day-to-day basis. And so because that reality was in my face, every day, I had to use my imagination and escape. And I would often immerse myself in school and education because that was where I can get away from my current household. Every time I came home, I was always witnessing things like there was a strange powder on the desk, or there was something going on in the backyard where one of my uncle's friends was overdosing. I knew the sound of gunshots. They were very familiar while I was growing up, and so my idea was I needed to get away from all of this. I didn't want to be a part of this, and so I would immerse myself in school all day, every day. I can remember back in high school, I would go to school at 7 a.m. Because that would be the time where they would start making the cookies. And I would help make the cookies because I would get a free one afterwards. Enroll in all the extracurricular activities, swim team, interact, meeting, band, because they practiced after school. And so, I was at school from 7 a.m. till 5 p.m. And then I even discovered that the high school had night school, and I enrolled in that as well, which kept me in school until 9 p.m. because I didn't want to go home. I didn't want to go home to witness any of the substance use because it was a very negative impact, had a very negative impact on my life. And I didn't want anything to do with it.
Wow. We know that adverse childhood experiences put people at risk for depression and anxiety, and also in line for substance use. It sounds like you really didn't want to have anything to do with it, but eventually drug use became part of your life
It did. I remember promising myself, and I would say this, I would never use any drugs or substances because I witnessed a lot of it in a negative light with my family. And so I promised myself I would get as much education as I can. I would get myself into college, which will then help me to get away from my family environment. And so I did exactly that. I got myself into college. And right after high school, I went in, and that was where I experienced substance use in a different light, in a different perspective, because I saw people that looked just like me. I saw people that were my age, and they were engaging in using substances, and they were having a good time. And they were going to class, and they were doing things that I wanted to do. And so that was a shift for me in my perspective, because I was like, okay, well, if they can do it, so can I. And so at that moment, that's when I started, I made it okay for me to start drinking alcohol. I made it okay for me to start smoking marijuana. And so that was the start of my substance use when I went into college.
So I know that you made it through college. You graduated, you have a degree. But at some point, things escalated for you.
They did.
When did that start to happen?
So in college, it was always alcohol, marijuana. I would experiment with other substances because my perspective had changed, and I thought it was okay now to explore. And with that exploration, I would often go home on vacations and for winter break or spring break, and going home, I had the thought of, okay, now because I'm using these substances, I can now relate to my family. I can relate to my uncles who I often shunned and stayed away from. And so these long breaks would then take me to hang out with them the whole time. And their drug of choice was often the harsher ones. So methamphetamines and alcohol. And then it was mainly the methamphetamines and crack cocaine. And so because that was there, and I wanted to relate to my family and show them that I was, a part of them, I would engage in those drugs while on vacation. And then I would go back to college. I barely graduated college, but that was my kind of gateway to me starting to use drugs, that whatever was in front of me. So when I graduated, I went back to my home environment, and it was the same environment with my uncle still engaging in substance use. And the only things that were in front of me were the harsher drugs. So methamphetamine became a drug that I used on a daily basis. And that was in 2000. I graduated in college. And from 2000 until 2010, I was engaging in substance use.
Wow, that's a long run. So at what point did your drug use turn from, did it become a problem? I know in college you described what sounded more like functional drug use.
Yes.
You get out of college, you're using, it starts to get a little bit more dysfunctional, like what you grew up with.
It
right?
did.
So talk to us a little bit about that, what that started to look like, where it took you.
It took me to a lot of places. And so methamphetamine usage became a daily activity for me. So it was a daily thing. I had to figure out how to get it, where to get it from, and then how to maintain it on a daily basis. And I thought it was functional from when once I graduated, I started trying to get various jobs, but they were never my focus. My focus was getting and using. And so I could never establish myself at a place of business. And the easy answer to that was to find a job that would kind of coordinate with my drug usage. And that took me back to the company that my mom had. She had a maintenance company that would clean facilities. And so once I was able to become a part of her company, she was a little resistant on having me to be a part of it, but she needed the help. And so what better job to have than a night graveyard shift job where nobody was around and I can use and clean. And so I was cleaning with my mother's company, and still using substances on a regular basis, because that would give me a paycheck to then all go towards my substance use. And it was only a short while I had that job, and it was my mom's company, and she had the top franchise. We had so many accounts, and I was in charge of 2 of them, and the reality of it was I didn't care about that job, but it was a paycheck for me. And it all came to a close at the moment when one of my partners on the job had just met somebody who was released from jail. And she asked me, let's bring him to help clean. And I was like, okay, because I would be done faster and I would be able to get home and get high again. And I didn't know this person's name. I, didn't know anything about them. All I knew was we had an extra hand to help. We brought that person to help clean. This person did not come to clean. They came to take a couple laptops from the accounts and hide them in the back seat of our car. And, we finished cleaning. I went home. This person suddenly jumped out the car and said, I gotta go. I didn't know why, but I found out later that day when the accounts called and said they wanted to meet with us. And so we went to go meet with my mom with the accounts, and we're sitting at this round table, and I thought, okay, well, I'm still under the influence off of meth. Let me smoke some marijuana to calm down. And I go there, and we're sitting at a round table, and they're saying, we have your crew on camera stealing equipment. What do you have to say? And my mom is just looking at me, waiting for me to say something with her face of disappointment. And I couldn't say anything. All I can do was shrug my shoulders and say, I don't know what happened. And that was the downfall of my mom's hardworking company that she's had since I was in high school. We lost all of our accounts. And that was kind of one of the turning points that should have made me realize I had a problem. But I didn't care. I didn't care because I wanted to continue to get high. And so that's what I did. I no longer had a job. And so I had to figure out, what can I do to still, get my drugs, and stay on this substance, and so that progressed into me, recycling every day, and then eventually continued into criminal activity, and where I would go to stores and steal cosmetics, and want to sell those cosmetics for a cheaper price. I always had justifications when I was using. And so the first justification was recycling. Recycling is great for the environment. And so let me help the environment and recycle, and then I can, trade it in and use it for drugs. The cosmetics, my justification for then stealing cosmetics was, let me take these cosmetics, which are overly priced, and sell them at a cheaper price because it helps people feel better. And that was my justification to make it okay for me to do it. I wasn't very good at it though, because I kept getting caught.
Right. And eventually getting caught landed you where?
So I kept getting arrested, but I was being released because I didn't have anything on my criminal record. But eventually, one after the other, landed me into, at the police station. And then I was like, are you going to release me? Can I go now? And they're like, you're not going anywhere. We're going to take you to LA County Jail. And so before that happened, I do recall a situation where I was sitting in my car looking in the rearview mirror and asking and pleading and begging for help. And I was like, I was talking to myself and talking to my higher power, and I was saying, I need help. I need something to happen to help me. I don't know, whatever it is, please help me. Because I didn't know how to stop using. And that was before the big arrest, right, where I was taken to LA County Jail. And I've never been to LA County Jail. I was scared out of my life. All I remember was people telling me, if you ever go into LA County Jail, make sure you tell them you're gay. Because you would go into a specific cell. And so every window I was going to is like, is this where I tell you I'm gay? Is this where I was so scared because I didn't know what was going to happen next. But the reality of the situation was, I asked the universe for help. Right. And the universe answered.
In the strangest way.
In the strangest way, they said, you need to get taken out of your environment. You need to go into this environment to actually have time to think about what happened. And that was the answer to the situation. I didn't know at the time. I was really upset and going out of my mind. But that's where my recovery journey started. I was incarcerated. I am blind as a bat. They took away my glasses because they were considered a weapon. And so I was in the LA County Jail, Twin Towers, with no glasses. And I didn't know what to do. I thought everything was over. I didn't want to be in a place with these people, and I was those people.
Right.
And it was just a big shock for me. But it was something that needed to happen because it was the universe answering and telling me I am going to get better.
Right. And I know that another thing happened that I would love you to talk about, how just when your prayers, so to speak, were answered, another thing happened while you were there.
This was the biggest sign for me because the Tarzana Treatment Centers has an incarceration services program that goes into the jails that provide case management services to individuals, and
Which is the one you're working for right now.
which is the one I'm working for now. And so I came up on the list. I was pulled out of my the dorm, and I go into this room, and I was wondering what was going on, what I need to do. As soon as I walk into the dorm, the person standing in front of me was my old college roommate. And he told me, "We've been looking for you." And at that moment, I knew everything was going to be okay. Because that was the other sign I needed to get me through this, whatever was going on. And so once that happened, he couldn't case manage me because a conflict of interest, but he just came along with the case manager that was assigned to me. And I was told, do whatever they tell you. And that's what I did. I did whatever they told me. Anything they asked me to do, if they told me I needed to get myself into treatment. They told me to just do whatever I need to do to lay low and get released, and then get myself into treatment. And that's exactly what I did.
That's an incredible story.
Yes.
Well, we're almost out of time, so I want to make sure that we are able to offer information to people who are in a similar situation that could benefit from your personal story and the services that we have at Tarzana Treatment Centers. So if you're out there and you need help, we're going to leave some information for you after this program ends, and give us a call, because things can change. Things can absolutely change. We have Living Proof with us right here, and we have many more stories just like that. So thank you for joining us today. Thank you, Cesar, for sharing your story with us today. It's incredible to have you.
It was an honor to be here. Thank you so much, Joseph.
All right.
Brought to you by Tarzana Treatment Centers. You can visit our website at www.tarzanatc.org or call 1-800-996-1051.